Good evening. My name is Chinesa Onyeje. I'm presently a family nurse practitioner, but I'm in school at Brandman University for a DMP degree and psychiatric mental health nurse practitioner certification. I'm going to be presenting on personal plan for innovation and leadership in DMP role. What is leadership? Leadership requires an individual who is committed and passionate. Leadership creates positive change within the healthcare setting. The kind of leadership style adopted by a leader influences the productivity and welfare of her subordinates. It is the most significant factor that any organization needs for success and growth. Let's look at DMP leadership role. The role of a DMP prepared nurse practitioner is to implement evidence into practice. She functions in roles of a change agent. She is trained to educate and convince others to buy into innovative ideas for change while providing guidance throughout the process. My current strengths are integrity, hard work, good communication skills, mentor. I have trained so many new nurse practitioners and student nurse practitioners. I'm a motivator and, courageous as well, even when things are difficult. I keep moving forward. And this brings me back to my personal philosophy. My personal philosophy is a belief that, to do the best good that is ever possible for all, more so to the patients, to instill hope and offer relief through my DMP role, leveraging on my expertise in family nurse practitioner and psychiatric mental health practitioner as well. My personal vision is to create access to quality healthcare for the underserved to help them on their path to better health. And my personal mission is also committed to rendering consistent and quality healthcare to my population of interest using innovative evidence-based practice to address the unique needs and values of my patients and their families. My plan to keep current in credentials is to, set up a reminder date on phone app for license and certification renewals. And, DEA license is renewed every 3 years. And CDS license is renewed every 3 years. NP license is renewed every 2 years. And ANCC NP certification is renewed every 5 years. My plan to move forward in broadening expertise and credentials is to, first of all, secure employment as a psychiatric nurse practitioner after I graduate and obtain maybe 1 to 2 years of hands-on experience in the field, then integrate family nurse practitioner with psychiatric nurse practitioner into private practice by year 2022. My plan to attend workshops, conferences with planned projection. And so I plan on attending Psychiatric Congress conference in September 10 to 13, 2020 in Nashville, and October 29 to November 1, 2021 in San Antonio, Texas. The base price for each of these is $650, excluding accommodations. I would also like to attend the American Psychiatric Nurses Association annual conference in 2022, and price is about $799. My local organization, nursing organization, is called Nurse Practitioner Association of Maryland, NPAM. They host conferences a few times a year as well, and I plan to attend at least one annually. Research, policy change, funding, publications. For me, it will be literature review for best evidence into practice. That's what I will use. I will, seek for membership in some of the nursing organizations, nurse practitioner organizations, such as Nurse Practitioner Association of Maryland, American Association of Nurse Practitioners, and there have been many policy changes that they advocated that actually passed through into law, and some of that Affordable Health Care Act of 2010, whereby many people can now go to the insurance marketplace and purchase their insurance at a fairly reasonable price. At least they have a bargaining power. Another one that they pushed through that actually was passed into law was veterans direct access to NP care. And that went into law in 2016, and it means that VA patients can now be treated by nurse practitioners or PAs, which didn't used to happen before. The third one that I looked up was the Comprehensive Addiction and Recovery Act, called, another term for it is CARA, C-A-R-A. That was passed into law July 22nd, 2016. And this one gave waiver to qualified nurse practitioners and PAs and the authority to prescribe ibuprofen. So for 5 years, and that is ending like 2021, I believe. Yeah, 2021 for 5 years. So that's some of the policy changes that some of the organizations have done, and I would like to be a part of it to lend a voice to the changes being made. Also, I already subscribe in Audio Digest, and that is sort of a journal where all the information that they put out is evidence-based, well-researched. I do that annually. I use Up to Date, a textbook, and Kaplan and Sadok, our textbook. Identify what is for fun or relaxation. For me, yoga, exercise every evening with my son. That is very, very relaxing. And reading, I read a lot. Family time is on Sunday morning in church, evening games that we play. That is also very rewarding. Family vacations from time to time, movie on Saturday afternoon with friends or family. Needed resources to attain a balanced life. That would be evidence-based resources and guidelines that I would put into practice. Also, I would have malpractice insurance for financial protection, health insurance, for, when you're sick or when the family is sick, quality time management skills with the least and highest priorities assigned, and the calendar to set up due dates for tasks to avoid dumping and burnout on myself. Essentials for personal fulfillment. Contentment with position in life, be part of it, adequate sleep and rest pattern, volunteering and goodwill donation to the needy, and achievement of set goals, because there is fulfillment when you get all your tasks accomplished. So that would be part of my personal fulfillment. Integration of personal fulfillment with the demands of life in practice. This is where work-life balance would come in. Balancing work demands and schedule with personal or family life. Personal or family vacation would take me away to a different environment that is relaxed and stress-free, and participation in cultural community events, which is done almost every Friday. So that exposes you to others, your peers, peoples of like mind, and, socialization. what I can sacrifice without sacrificing personal mission and vision. There's really what I could really come up with is that I can sacrifice enough time up to a point where I'm not taking away from my personal mission and vision. It is all about balance. My current resources. I have a lot of books, and some of the names are Advanced Practice Psychiatric Nursing Textbook, Current Medical Diagnosis and Treatment Textbook, Kaplan and Sadok Synopsis of Psychiatry, Behavioral Sciences, Diagnostic and Statistical Manual of Mental Health Disorder, Hippocrates, Up to Date, NEI, Audio Digest. And my references are all here. I thank you so much for listening. Have a good evening.